The topic of fluoride in drinking water recently became a controversial conversation. The city of Winter Haven even voted last month to remove it from their water supply.
Some groups are voicing some concerns over fluoride toxicity. They're asking if we're getting too much. Well, we took those concerns to the experts. ABC Action News reporter Larissa Scott found out how much is too much.
Fluoride is a natural occurring mineral that can be found in dental products and water supply. Fluoride is primarily used to prevent tooth decay and cavities by strengthening tooth enamel. Questions surrounding the safety of fluoride started swirling nationally a few weeks ago. The concern is that when it's ingested in high concentrations, it could be associated with cognitive issues in children like lower IQ.
There have been some research studies that have shown that fluoride levels, fluoride exposure to children can impact, at least according to the studies, cognitive outcomes, negative behaviors.
The Cleveland Clinic says fluoride can be harmful in large quantities, but that it's difficult to reach toxic levels due to the low amount of fluoride in drinking water and over-the-counter products like toothpaste and mouthwash. The American Dental Association, the American Academy of Pediatrics, and the CDC have backed the use of low levels of fluoride in drinking water for decades and still do. Last month, the Florida Surgeon General went against those groups, encouraging cities to stop adding fluoride to water supply.
It is public health malpractice to continue doing it.
With these growing concerns, the city of Winter Haven even recently voted to stop adding fluoride to its water supply by January 1st. So I talked to pediatric dentist Dr. Maggie Davis in Palm Harbor about this issue to get her professional opinion.
Is there a concern with ingesting too much?
Yeah, I mean, as a mother and as a pediatric dentist, you should always be looking for that therapeutic dose. Not too little and not too much.
Dr. Davis tells me she stands by the safety of small amounts of fluoride in our drinking water and dental products and says it's a key part of reducing tooth decay, especially in communities without access to dental care.
I think if we were to take that away, we would see a gradual increase in the rate of cavities. Actually, in a tube of toothpaste, we are actually seeing a higher concentration than in our community water sources.
Holistic pediatrician Dr. David Berger believes it's important to weigh the pros and cons and risks versus benefits, and that there's not enough research on the issue yet, especially not enough to change national policy.
There probably is some type of sweet spot here. We know that. I mean, it's part of enamel. It's part of our dentist. So is there a way that we can make sure that people are getting the right amount?
That was Larissa Scott reporting. If you have concerns about fluoride, you're urged to contact your doctor. We have much more information about fluoride and a link to a study about it right now on our website. You can find it at abcactionnews.com.